Hello, everyone, and welcome to the Flatlining Podcast from Fulcrum Strategies. I'm Matthew Handley, and with me is our president and CEO and economist, Ron Howergan. Ron, how are you?
I am doing well.
I do want to let everyone know before we get too deep into the program, we did experience some technical issues today, but I think through the magical power of editing, we were able to clean them all up. We've got two kind of interesting topics today. In a few minutes, we're going to talk about a Supreme Court case about whether or not COVID misinformation is counted as protected speech and what kind of implications that could have for the free practice of medicine. That's coming up in a few minutes. But first, there's a new set of rankings, Ron, from Just Capital and CNBC that list what they are calling the most just companies in the United States. And by just, they're taking a look at how they treat their workers and customers, how they support their communities and address environmental impacts, as well as their corporate governance. And the reason I bring this up, Ron, is in the top 10, we have two major health insurance carriers pop up. We have Cigna at number 6 and Elevance at number 8. And I wanted to pick your brain a little bit about this and think about some of the other current event items that are going around with these companies, in particular, a class action lawsuit against Cigna, and how these companies, in your mind and in the mind perhaps of physicians, would be ranked as just companies.
Absolutely. Yeah. So, when I looked at this list, there were a couple of things that struck me. And first one was, which is not surprising, is that the whole list is primarily what you would be considered either high tech or white collar companies. Mm-hmm. You don't see tobacco companies on here. You don't see, major manufacturing companies to a large degree. So, and that would tend to make sense. The other thing that, and I look at this with these kind of jaded view whenever somebody brings out any kind of a poll. And the first thing I think about is, well, the last two elections weren't really accurate in the pre-election polling.
That's true.
And I'm not going to get too geeky in my statistics degree, but we have a problem right now in any kind of a public opinion polling, whether it's political or things like this, in that we no longer have the ability to create an unbiased sample. And there's been a lot of research in this, especially with the political polling. And the reason being that for years and years and years, the ways you conduct polling was you called home phone numbers, and you could get a pretty good unbiased sample. Now you can't, because there are many families, myself included, that don't have a landline.
Yep.
We use cell phones, and those aren't as easy to get to. And so what they know is that the people who are answering home landlines are skewed. They're skewed by age, they're skewed by demographic, they're skewed by, and that's created problems with the predictability of the last two election polling. And there's not a great way to get at the whole population. So part of me says, I'm not sure whether this is really reflective, or I'm not sure it isn't, because all this polling stuff is pretty questionable. Now, to the question of, if you asked, let's say, their direct customers. Okay, let's say you could, for each of these companies, ask their direct customers, whether that be the physician customer for Cigna and Elevance, or the people who have their insurance. I think you might get a very different response than the general public, per se. That was what I took from it.
No, and I agree, particularly because Cigna's got that class action lawsuit against them for the use of PXDX and all those denials. And I can tell just from experience, and I know you have the same experience as well, working with our clients at Fulcrum Strategies, just trying to get basic information about contracts from some of these companies is next to impossible sometimes. They make it very difficult for providers to stay on top of what they should be getting paid and what the terms of their agreements are with the insurance carriers.
Yeah, I mean, I remember when I worked for Cigna, I could remember, and I hadn't been working for them very long, and somebody who had been there for a long time, now this is many, many years ago, said, well, you know what Cigna stands for, don't you? And I said, no, I don't. And he said, CIGNA, you know what that stands for, don't you? And I thought I was going to impart some wisdom on me and how the company name came in. I said, no, I don't. He said, it stands for call in, get no answer. And that was an internal employee joking around about that. Yep. So, yeah, and that's, I'm sure that, there's a lot of big companies that have those kind of self-reflective feelings. But yeah, I mean, our clients would definitely not rank Cigna high up in the just companies list.
Yeah. And I would add in too that perhaps with some of these other companies, even if they've got the same kind of attitude towards their own company, it's not healthcare. Healthcare is a little bit Healthcare is a little bit more sensitive for people because it's it's a little bit more necessary than well, I won't say semiconductors aren't necessary from Intel, but because those are used in almost everything today. But I just thought that this was an interesting ranking list, and I thought it was interesting that Cigna and Elevance, obviously the parent company of Anthem, making it into the top 10. I do know that there were several other payers that made it into the top 100, including Humana, United, CVS, and Centene. Excuse me, they were in the top 200. You can look at their rankings on the linked article in the show notes if you're curious. But again, Cigna and Elevance being ranked as some of the most just companies in the U.S., and I find that a little bit laughable. And with that, we are going to move on to something a little bit more pressing and a little bit more relevant, I think, to our clients, and that is this Supreme Court case that is going to take a look at whether or not COVID misinformation speech is protected speech. And as you may be thinking, why are we still talking about COVID? It's 2024. We've moved on from the pandemic. But some of the laws that have been passed in this country, I'm thinking in particular with California, I'm thinking in some of these other states as well, where they have tried to make it so you cannot spread misinformation about COVID-19 or any sort of, perhaps medical advice without the possibility of losing your medical license. And that's what they try to do in the state of California. I'm curious, Ron, what you think this means for the practice of medicine in general, and how providers can or will not be able to make their recommendations to their patients. What do you think about this case?
Well, first of all, I think a couple of things. The idea of free speech is probably one of the most narrow eye of a needle that the courts have to thread of all the rights, if you will. I wouldn't want to sit on the Supreme Court and get involved in these kind of cases because, there's easily, I think, decent arguments, both pro and con, on that free speech right. The other thing that I'm always reminded of, and I'm not an attorney, but I've had attorneys, explain this to me, that say there's no such thing as an unfettered right. That a lot of times the Supreme Court views these as you have the right to life, happiness, pursuit of happiness, et cetera, up until the point where it injures or damages somebody else or infringes upon somebody else's rights. So your rights stop at your doorstep, so to speak. And that's, I think, really what this one gets into is we all want free speech. We just don't want to do it, at the expense of others. And that gets into that whole, you can't yell fire in a crowded movie theater kind of thing. Yep. You can't use free speech to incite violence on someone else.
Right.
When it gets into medicine, it adds another layer of complexity, which is, should physicians be allowed to express their clinical opinion, even when it may fly in the face of others' clinical opinion? And that's really, I think, where the whole COVID thing came down. Where people have said, well, as a doctor, this is my clinical opinion, and I believe that this. And even if the vast majority of other doctors disagree, where do we start to draw that line and say you can't say that? And then the other side of it is, and what damages or what recourse can you have against a physician who is spreading what others believe misinformation? And now we get into the whole issue of malpractice. A doctor can tell their individual patient, hey, I don't think you should do X. And if that results in a negative outcome and that doctor is deemed to be negligent for doing that, they can be sued for malpractice.
Right.
Well, should physicians who, and I'll take COVID as an example, publish on a social media site, I don't agree that anyone should get the COVID vaccine. It's my clinical opinion. Can somebody then sue them if they get COVID and die and say, I was following your medical advice? Or do they have to be their direct patient? It gets into a really, really sticky issue. In general, personal opinion, I don't like the idea of limiting this kind of free speech. No. If a doctor wants to say something on a social media site, I don't like the idea of who's going to be the arbiter to say you can't say that. My own personal opinion. Now, I also think there were a fair amount of doctors that were spreading really crazy, unfounded, unscientific things, and I didn't listen to them, but I know there were some that did. And I think there were probably some individuals that were damaged because of that. So this one's, like I said, this one's tough. I don't like restricting physicians in general. But then it raises the question of what responsibility do they have? And can they be held responsible in their medical license?
Right.
Which is a whole different question.
And, and we had that conversation, gosh, I want to say it was like 2 years ago now, about a particular physician who had written a book under a pseudonym. Mm-hmm. Yeah. And he seemed to have kind of this, and he's not the only one, but he seemed to kind of have this Galileo complex of people are censoring me because I'm speaking out against an issue that, I think the establishment is wrong on, and I'm going to be proved right in the end. How complex do you think that this issue of, being a martyr in this sense, how much worse is it going to make it for actual medical misinformation? Not stuff that's borderline where we could talk about, borderline, medical advice, but stuff that is legitimately, bad advice. How much worse is that going to make it if we start making martyrs out of particular individuals?
Well, and I think you hit it right on the head. In some respects, as soon as the government tries to stamp down something, there's a segment of the population that's going to see that must be right, and they're going to flock to it. Rather, saying, well, geez, that's interesting. They're recommending that you drink bleach. Boy, that probably isn't a good idea. And here's all the clinical reasons not to.
Right.
Or here are the millions of physicians who think that's probably a bad idea. But the instant the government says you can't say that, it gains credibility just because of that. And I think that's part of the reason why that stuff, had the kind of life that it did. Was the, whether they were telling them to absolutely get it off your site or suggesting that they did or whatever, anytime it feels like the government's trying to suppress something right now in this environment, it gains credibility.
Now this particular case, Murthy v. Missouri, is alleging that federal officials had coerced social media and search engines like Facebook and Twitter and Google to remove or hide certain posts that question vaccine safety, in particular, COVID origins and shutdown measures. But like I said, this decision, depending on how it's decided and depending on how the opinion is written, I do think can have wider implications on other issues than just COVID. And the other point coming to be is, do people have a right to use things like Facebook or Twitter as free speech platforms, and do they have the right to say what they want on those platforms, particularly about medical issues? And then what stops people from not creating their own platforms to intentionally spread misinformation? Excuse me. And I do want to ask you, Ron, too, is the damage already done in this instance? Because whether or not Facebook or Twitter or Google censored certain opinions during the COVID pandemic or are continuing to censor current opinions, there's a perception that they are. So is the damage already done by those who are convinced that, they're being censored and their medical opinion is being censored, and therefore that they must be right?
I think to some degree the damage is already done. Hindsight always being 2020. I think the fact that whether it was actual coercion or whether it was a suggestion or not, the belief is there that the government tried to suppress free speech, and therefore the damage is somewhat done because it lends credibility to it, and that belief's already there. That's going to be hard to overcome. And so I think, like I said, to some degree that damage is already done. The other thing that sort of is interesting in all this whole discussion, and I've had arguments with people about this, is, whether it's Facebook or Twitter or Google or whatever, those are not public entities. It's not like, the airwaves for public access broadcasting. Those are private companies, and they're companies that can allow members to access them or not access them. They're companies that could charge for membership if they wanted to, and some do at some levels, et cetera. So the point that they have to allow complete free speech, I don't think personally exists. Just like if I'm the owner of a restaurant or a bar. I mean, my father, when I was young, owned a bar, and we could refuse to service anyone as long as we weren't discriminating. We couldn't say, well, I'm sorry, but African Americans aren't allowed in here. No, that's discriminatory. There's different laws.
Right.
But it was my dad's establishment, and if somebody walked in, he said, I don't want to serve you, he didn't have to serve him. And so, Twitter or Google or whatever, I think as a private business has the right to say, I'm not going to allow this to be posted if it's non-discriminatory. And that's part of what I think, Facebook and them have said is that, no, we made that decision and it's our policy. Same thing with the kerfuffle when they would kick people off. It's not a public airwave kind of thing. A lot of people want to confuse that issue.
And in that,
but also as a private entity, if the government said, "Hey, we'd like you to take it off your thing," I'd say, "Go pound sand."
Yeah.
You can't tell me what to do. It's my company. And it's my community.
And there's that's where that question of coercion comes in. And you're right. Unlike TV or radio or even this podcast, the platform is not going to get sued for misinformation. The person who posted it on the platform can get sued personally, but the as far as I'm aware, Facebook and Twitter and others, or X, are now are currently immune from that kind of litigation. In the same way, so we're on Substack. You couldn't sue Substack for what we publish on there. You'd be suing us instead. Although that is not an invitation to do that. So
and the other thing that it gets to, and this is why it's such a sticky issue. Everybody likes free speech except for the stuff they don't agree with.
Right.
And that's, the same people would argue that, boy, you should let anybody put anything they want on Twitter and you should not, or Facebook or whatever. You should not suppress any idea around whether the vaccine was valid or not, or whether the disease came from monkeys or was intentionally released. All that should be fair game. And then you ask them, well, should it be fair game if somebody puts on their hate speech? Should it be fair game if they put on there that, we should kill everybody from a certain political party or from a certain persuasion or well, no, absolutely not. Well, hold on. I thought free speech was free speech. And that's the hard part, is where does that line get drawn?
We had a little bit of technical difficulties there, but we got Ron back. So Ron, I wanted to ask one other question before we wrap up today. And it has something to do with the outcome of this case and some of the implications it could have. We had an instance where the state of California was trying to, and I don't recall if they ended up passing it or not, they were trying to pass a law that would allow their state medical association to remove the licenses of physicians who were spreading COVID misinformation in particular, but other medical misinformation as well. And I think most people can agree on, most reasonable people, that is, most in the medical community can agree on what COVID misinformation is. But what happens when this spreads into other, perhaps more politically charged issues like, care for, an ectopic pregnancy or something like that, or care for a risky pregnancy, not necessarily even an ectopic pregnancy, where some physicians might advocate for an abortion, other physicians might advocate for some other course of treatment to try and save the life of the child. If it's politically convenient to advocate for the abortion, what happens then when the state decides, well, it's medical misinformation to say otherwise? Is that going to be interfering with the physician's ability to practice medicine, do you think?
Well, I think there are some physicians that would argue that, the elimination of Roe v. Wade and turning that question into the states interferes with their ability to practice medicine the way they want to. Okay. And so I think that, and I'm not saying whether I agree with them or disagree with them. I'm a fairly big for the most part, states' rights guy, that I think the Constitution illustrated the things the federal government could do, and everything else is states' rights. And you don't have sort of an inalienable right to practice medicine any way you want to in a given state. The state has the ability to create those parameters. They already create parameters around, training levels and what certain levels of providers can do versus not do. And some states, mid-levels can practice more independently than others. So they already do restrict practice. And so if a state wanted to pass a law that says this is considered misinformation, I think they should have the right to do so. Now, I will say the one thing I like about it, if states have these kind of licensure things going on, is at least the physician in question is afforded A, due process,
right?
Because they got a process of doing it, and B, if a law, and let's say, and I'm not saying this, let's say a state passed a law that said it is now considered illegal in the practice of medicine in this state to even talk about an abortion. I don't think any state would do that, but let's say they do that. Then the physician in that state would see it coming, would know it got passed, and could choose to practice in another state. So I'm not as worried about states getting into this because A, I think it's their right. B, I don't think they're going to go too far. C, the physician's going to have due process. And D, if they don't like it, you can move to another state. Right.
Voting with your feet, in other words.
Exactly. And so can the people who live in that state, so.
Well, Ron, even with the technical hiccups, I appreciate you sitting down with me again to have these conversations here on the Flatlining Podcast.
No problem. Enjoyed it as always.
Miss an episode of the Flatlining Podcast? Well, now you can read a recap. Just go to flatlining.net and look right there on the homepage every Monday for a written recap on last week's episode.